Hello everyone, my name is Kwame Sewusu. Welcome back to the Shelf Conversation, and today I've got
Dr. Tanvir Alam, GP with interest in physical health of SMIs and Deputy Medical Director of Northeast 6 ICP.
Thank you very much, Doctor, for giving us the opportunity to actually ask these questions. So today we are here at Aston University at the Silos and Synergy Conference, and I've got a few questions because today's conference is about how we are trying to minimize the gap between severe mental health illnesses and chronic kidney diseases. So, Doctor, the question I've got for you is, what system pressure most limits your ability to provide holistic care for your patients?
One is resource limitation in terms of access, because we have now unlimited access to primary care. So because of that, we don't know what is the quantum of acute illnesses or chronic illnesses, and we have to balance that out together. That is a system pressure. So everybody wants an appointment today, but do they actually need an appointment today? It's a contentious topic because obviously the patients want to be seen as soon as possible. So prioritizing patients based on clinical risk and harm is a challenge when the national narrative is to push that forward, at all costs. So I think that is one. And secondly, we have resource limitations with our secondary care providers and our hospital trusts also struggling with elective recovery, and the fact that they have a long waiting list. And in fact, the waiting list still stands at 7.3 million patients, and that is not the fault of primary care. While some portion of those referrals may be inappropriate from primary care, there is still a lot of them that need to be held in secondary care. So that is a great resource limitation. So working on the elective recovery, improving the interface between primary and secondary care, while managing the load of primary care are the three greatest challenges right now.
Thank you very much. And to you, what does silos to synergy mean to you in practice?
So I think we're all working, in our individual capacity. Like I have an interest in physical health of SMIs, so that's why I have worked on that by doing innovator role as a GP in acute services. That's not everybody's cup of tea. Not everybody can get involved in that space. So, and we've heard from colleagues today who've been doing individual pieces of work in the pharmacy landscape, and obviously our consultant nephrologists who are dealing with complex chronic kidney disease. But these are all examples of people who are working individually to help the physical outcome of these patients with significant mental illness. And I think that's the purpose of today's conversation, is to bring those individual actions and come together. While individual actions lead to systemic change, we do need to bring all of these together under one platform so that we can do better for our patients.
All right. No worries. Thank you very much, viewers and listeners. I hope that you learned something